حقت الدكتورة.
ليش يا جماعة؟
أيوة أستاذ هشام. عليكم السلام. أنا على الموقع خلاص. خلاص. ما أنا شفتها. أشكرك ربنا يبارك. شكرا. ما فيش مشكلة، أقفلها أنا. ما فيش مشكلة عشان ما أقدرش. حاضر، تحت أمرك حبيبي. ربنا يبارك فيك إن شاء الله. تحت أمرك.
انزل تحت شوي. ماشي، خليك زي تفضل. يلا. واحد، اثنين، ثلاثة، أربعة. يلا. عد. واحد، اثنين، ثلاثة. يلا عد. أربعة. يلا كمان. إيش هذا؟ إيش هذا؟ فين هذا؟ شفت إعلانات؟ شفت إعلانات؟ هو شفت إعلانات؟
دكتور الصورة أول ما جيت البيت أنا بس لو تلبس الكمام أبشر.
الله يجزاك كل خير.
أول ما جيت الدكتور كان يتكلم وتفاعل.
تعطيني رقم تليفون.
05
05
44
44
60
60
81
8 1
65.
6. أنت أمها وأبوها؟
لا.
نحاول الحين نحكي.
دكتور علي باشا، اخبارك؟
احمد بيه، ازيك يا حبيبي؟ اخبارك؟ وحشني.
الله يخليك. بالتوفيق ان شاء الله حبيبي، بالتوفيق ان شاء الله.
نبدا. الدكتوره غاده مش عارف
دكتوره
مش
غاده
عارف.
بقى ما
السلام
انا مش
عليكم،
عارف.
كيف الحال؟ الله يعطيكم العافيه.
دكتوره غاده، ازي
دكتور علي
حضرتك؟
على التحضير، وان شاء الله هذه بتكون طبعا اخر محاضره عندنا في السنه، وختامها ان شاء الله مسك، وهذه اخر مره بكون معاكم يعني مش زميله، يعني مسؤوله عن المحاضرات، وبيستلمها ان شاء الله بعد زميل اخر. بس سعدت معاكم جدا في الوقت هذا، وصراحه كانت محاضرات والتعامل مع الزملاء جدا سلس، والحمد لله رب العالمين تعرفت على اغلب زملائي. ان شاء الله يا رب نشوفكم مناسبات اخرى. طبعا انا اعتذر عن حضور اليوم بعد، لان عندي اجتماع، بس يعني كنت لازم اقول لكم مع السلامه قبل ما امشي.
نفتقدك فعلا دكتوره غاده، ربنا يبارك لك دايما في اي مكان تبقى موجوده فيه.
لما اكون معاكم، لكن ما راح اكون مسؤوله عن المحاضره.
انا عارف طبعا، انا عارف طبعا. ان شاء الله دايما تبقي معانا في الخير يا رب ان شاء الله.
الله يسلمكم، ان شاء الله نشوفكم على خير.
سعدنا بيكي وبادارتك للجروب يعني ما شاء الله، وباضافتك العلميه، ويعني كان في سيشن كتير كنت انت يعني انت بتقومي بالدسكشن الوحيده يعني، فغطيتي جامده جدا، اشكرك عليها بصراحه.
الله يسلمكم ان شاء الله، وسعدت فيكم جميعا
بقى ان شاء الله تكوني معنا ان شاء الله.
الله يسلمك.
طيب، بسم الله الرحمن الرحيم. السلام عليكم ورحمه الله وبركاته، زملائي وزميلاتي الاعزاء. اهلا وسهلا بيكم. معاكم علي اسماعيل من مجران. هنتكلم النهارده عن non pharmacological management of ADHD. بعد بسم الله الرحمن الرحيم. as we know our agenda النهارده هنتكلم على introduction قصير قوي على ال ADHD، حضراتكم اعلم مني بهذا. ثم هندي هنت بسيط على ال ADHD diet and nutrition. بعد كده هنتكلم على الفود to avoid with ADHD. ثم هنتكلم على ADHD and exercise. اليوجا ومديتيشنز with ADHD، وهنختم بال ADHD coaching. دي our agenda. As we know, ADHD is one of the most common mental disorders affecting children. It's about 8.4% in children and 2.5% of adults. There is evidence of genetic predisposing for ADHD. 3 out of the 4 children with ADHD have a relative with this disorder. There is another biological factors related to the born premature, brain injury, mother smoking or alcohol, external stress or extreme stress during pregnancy, with the social stressors related to the parenting and something others. As we know, this is a common symptom and sign of ADHD in children. According to, we have 3 types of ADHD. It is a compound type, ADHD and attention deficit hyperactive, or predominant inattentions and predominant hyperactivity. As we know, the hyperactivity is more prominent in preschool age from 3 to 5, and inattention is more prominent after this, whether school age, adolescent, or in adult. This is very important. The inattentions, so the attention deficits more apparent in the school age, so there is a delay in arriving of these children for management. According to male and female, the preschool age is more common in male, but in school age as equal as male to female, and the male is more prominent in adults or adolescents. As we know, the ADHD management, we have pharmacological management and non-pharmacological management, as we see many kinds of interventions, whether school intervention, parenting interventions, and something like this. We will talk about this in details. The first topics for this lectures, it's about the ADHD and diet. There is no clear scientific evidence that the ADHD caused by diet or nutritional program, but some foods maybe has a role in affecting symptoms. Here we answer about the questions about the eliminating diet, supplements, and the food maybe is the symptoms of these disorders. ADHD diet have not been researched a lot. This is a very important. We don't have researches or more researches about this. And the second, data is limited and the results are mixed. What is the meaning of ADHD diet? It is a meaning include the food you eat and any nutritional supplement you may take. This is what is the meaning of ADHD diet. The first diet is a high protein diet. As we know, the high protein diet is present in chicken, in beef, in egg, milk, high protein milk, egg, cheese, and salad. High protein diet is very important to improve the concentration and possibly make ADHD medication or longer. It is very important. It is improve the concentrations and improve the long-term medications. Number 2, the complex carbohydrates. We know the complex carbohydrate, banana, apple, sesame, potato with cover, broccoli, and something like this. It's very important, especially at night. Can be using this food in the evening. It may be help the sleep, especially in hyperactive child. What about the supplements? We have the most common supplement in ADHD is the omega-3. The very important slides, omega-3 can be increase the intellectual ability for measurement of intellectual ability 3.5 point after take of omega-3. And we have many others benefits for these. according to it is have related to the cardiac, related to the cancer, related to the cholesterol and triglyceride and something like this. As we know, the omega-3 including tuna, salmon, and cold water whitefish, and olive and canola oils. What is important? FDA approved omega-3 component is the valine. Valine is zoom or creole. This is one of the FDA approval management of drugs for ADHD. Nutritional supplement for ADHD, another we have as omega-3 again, magnesium, zinc, vitamin D is very important, and iron. Some experts recommended the people with ADHD take at least 100 vitamins and mineral supplementation each day. But others think the people who eat normal and balanced diet don't need vitamins or micronutrient supplements. So we have a debate in this area, but for knowledge, you know the diet or food related to these vitamins or these minerals. As we said before, omega-3 is a role, it have a role in focus, mood, and memory. Zinc-rich foods, it is more rich in eggs, potatoes. It is related to hyperactivity, impulsivity, and irritability. So if I have a patient with hyperactivity predominant, we can ask the parent to take zinc-rich food. Vitamin D-rich food is more present in fruits and whole grains. It is related to the energy as the zinc-rich foods. And the last one is the magnesium-rich food. It is the leafy greens and seeds, nuts. It is related to the restlessness and hyperactivity. The next one is foods to avoid with the ADHD. As we know, we talk about the simple carbohydrate. Simple carbohydrates, soda, cakes, cereals, honey, and something as these. Cut down of how many of these candy, corn syrups, honey, sugar, products made from white flours, white rice, potatoes without skins. It is very important to cut down or decrease the amount of this for the people with ADHD. Eliminating diet is very important. Eliminating diet, as we said before, this involves not eating foods or ingredients that you think might trigger certain behavioral or making your symptoms worse. This is the eliminating diet. As we said before, about the mono-carbohydrate diet. Research in all these areas is ongoing and the results are not clear-cut. Number 3, most scientists don't recommend this approach for managing ADHD. We talk about the food additive. Food additive, it is the beginning in 1975. The artificial color, flowers, and preservatives might lead to hyperactivity in some children. This is the first research about this. Some say the idea of cutting all those things out of this diet is unfounded and unsupported by science. One study only has shown that some food coloring and one preservative did make some children more hyperactive. So the food coloring and preservative may be related to hyperactivity more than the inattentions. But the effect, this effect is varies according to the age and the type of additive. Based on this study and or other recent studies, the American Academy of Pediatrics now agrees that eliminating preservative and food coloring from the diet is reasonable options for children with ADHD. What is What is the meaning of additive? It is the meaning artificial color, especially red and yellow color. Meaning of another as what aspartate. It is aspartate is present in all power drinkers, and monosodium glutamate and nitrates is related to the beef and something else. Number 3, high sodium benzoate. There is some link between the hyperactivity and preservative sodium benzoate. The second one for eliminating diet is the sugar, mono sugar. Sugars, some children become hyperactive after eating candy or sugary food. Number 2, sugary food should be small part of anyone's diet. Number 3, you carry to cutting them to see if the symptom improve. If there is no any problem, should be cutting or decrease the amount of the sugary diet or candy to increase to observe the effect of cutting of these sugars on the ADHD, especially hyperactivity. Caffeine, it is يعني تصور اثناء ما كنا بدانا نتعلم كان من ضمن الاستراتيجي اللي بنستخدم بالذات في الان اتنشنز قبل ما يطلع الاتوموكسيتين بالذات كان الكافيين، وكلنا عارفين ان الكافيين the most widely used stimulant and the most popular drug in the world. Small amount of it may help with some ADHD symptoms in children, especially in attention. Experts don't recommend this, giving caffeine to children, especially if they are taking medication of ADHD, as we said, as we will see, because the medications with the caffeine increase the side effect of medications. It can affect the brain development in grown children. With medications of ADHD, caffeine make some side effects worse. The American Academy of Pediatrics recommended no children should have energy drinks since the high level of stimulant, including caffeine, can cause serious health problems. So the caffeine is not recommended for the using of ADHD, even in attention or inattentive child. We are going to the second part of the topics related. What is the relations between the exercise and the ADHD? The exercise or study shows the exercise can improve the cognitive functions and even help diminish anxiety and depression. It is very important. Exercise improves the cognitive function in general, so it is very important for ADHD. When you exercise, brain release the neurotransmitters, especially dopamine, and we know that dopamine have an important role in attention and clear thinking. Number 2, research finds that getting regular fitness can improve the thinking ability and may improve the symptoms of the ADHD. We have many benefits rather than this for exercise. It is ease stress and anxiety. It is improve impulse control and compulsive behavioral. It is enhance working memory, executive functions, and it is very important. It is increase the level of brain derivative neurotropic factors. It is brain derivative neurotropic factors have a role in learning and memory, and it is short supply in people with ADHD. So exercise is very important to management of the child with ADHD, especially hyperactivity. More reasons for to exercise. The first, stay healthy. We know that amoxicillin may be increased and risperidone may be increase the weight of the children, reduce the risk of heart disease, diabetes, and cancer. Keep your blood pressure and cholesterol level in normal. Strengthen your bones and improve your mood and self-esteem. This is the study in 2017. The using of 26 minutes of exercise deal twice per week for 8 weeks, it is the change change the score of ADHD skills, and we know the difference between the brain without exercise and the brain with exercise. How often should you exercise? You can, the expert or health expert recommended 150 minutes per week. 150 minutes per week. It's about 30 minutes per day for 5 days. Any kind of exercise, can be done. Running, biking, aerobic class, weight training, any type may be done. And we recommended to change the type of exercise to prevent the loss of interest. Try to vary exercise routine, won't lose interest. The third one, it is yoga and meditations. Meditation and yoga highly effective for the ADHD children. Meditations are good ways to manage ADHD symptoms. Meditations have a role to thickening the prefrontal cortex, and we know the prefrontal cortex involved in focus, planning, and impulse control. So it's the meditation very important to increase the thickening of the prefrontal cortex. And here, the meditations rise the dopamine, and we know the role of dopamine of ADHD. One study found meditation of yoga or meditations for 20 minutes twice per week for 8 weeks improve the score of tests for especially attention and focus. The last one, we talk about the ADHD coaching. ADHD coaching. What is the ADHD coaching? As we know, it focuses on the practice ways to deal with everyday tasks that might together because your disease. ADHD coaching, it's a life coaching, skill coaching, and education. What is the difference between the ADHD coaching and CBT? CBT focused on the thoughts and emotions, but ADHD coaching teaches how to adapt positive behavior. It is related to the what is called as a Gestalt called here and now. The teachers can help both children and their parents learn more about the disease, find new ways to approach life with itself. The benefits of ADHD coaching: focus, clear, confidence, increase the success at work, or increase the success at school. ADHD coaching, it is related to as a CBT. It is the psychoeducation. We talk about the psychoeducation. We talk about the diagnosis, stress management, exercise, lifestyle strategies, nutrition, education and support, therapy, and adherence to medications. So the ADHD coaching, it is the co-management with the therapist or with the physicians. Who is ADHD coach? We have 3 types. The first, it's the licensed mental health professionals as us, who focus slowly on the ADHD coaching, or one who include it as a part of their practice. I think this is easy for us because we have the psychotherapy in our practice, so there's no more difference between the ADHD coaching and CBT. The second one, a certified teacher or degree professionals who has ADHD coaching practice, especially at school and college. The third one, it is the more weak. It is the ADHD coaching not licensed in mental health, but licensed in coaching society. But this needs some rules, as must be take training about the ADHD, training about the diagnosis, training about the management, and something else. What is the methods of coaching? we talk about it before. It is the near way to the CBT and others. Goal setting. Number 2, prioritizations and motivations, organization skills, planning and scheduling, problem solving, stress management, impulse control management, increase the confidence and self-esteem, building the relationship and communication skills, memory improvement, and homework activity. As we said, there is no more difference between the psychotherapy, but it's more organized. As we see, the coaching beginning life map, then we can we can find the goals, action plans, and participate and then activities after this. Last one, what is the home message? The first home message is ADHD is a chronic disorder and more prevalent. The second, pharmacological therapy and non-pharmacological therapy are very important for management of ADHD. The third one, please use all available services to manage your patient. As we see, you can use a diet, you can use practice, you can use coaching, you can use learning educations and something like this. The supportive and educational psychotherapy are very important, especially for the parent of ADHD patient. And last one, emotional support for the patient and his family and their family is very important. And last one is thank you for your attention. If there are any questions or comments, please.
Very nice presentation, Dr. Ali.
Thank you, Dr. Ahmed. Is there any comment, Dr. Ahmed? دكتور احمد مش عارف في another comments يا جماعه.
الو
ايوه يا دكتور احمد.
دكتور علي.
ايوه يا حبيبي.
hear me now?
ايوه يا حبيبي سامعك.
Yes, okay. Yeah, thank you for this very nice presentation, and I would comment or ask you if you find any studies that concerned about the difference between pharmacological or non-pharmacological management of the ADHD, and concerned mainly on coaching or supplement like that as a comparison, or the combined more better, as you mentioned. Yeah.
For researches, I didn't find. For my knowledge, I didn't find this is comparison. But for experience, we find this. We find the using of pharmacological with non-pharmacological management of ADHD or any psychiatric disorder, it's very, very, very strong to decrease the first, decrease the doses of the drug, second, decrease the durations, third, prevent the complications. We know at least 20 to 30% of the child with ADHD have an anxiety and depression, and their relative, at least 10% of the relative have an anxiety and depression. So using of pharmacological, non-pharmacological, even life coaching only, it is very important to decrease this. But I didn't have any research for about this.
Okay. Nice, very nice, Dr. Shukran.
Is there another comments? Thanks for your colleague, for my colleague and my audience. And if there is no any questions or comments, we going to finish this meeting, and we will meet you in next week, inshallah. Thank you for all. Another comment to everyone. ثانك يو دكتورة سناء.